Okay guys, this is a skill 18.3 advanced dressing change. You're going to check your physician's order and you're going to perform WIPSA. Okay, you're going to expose only the wound area. Okay, I've just taken an abdomen and put it on the table here to show you, because I wanted to be able to get up close and personal with it. Okay, so I'm going to remove that right at this moment and show you a sterile dressing kit. Okay, all right. So sterile dressing kit. We start off with our clean gloves on, right? Yes. Yes. So why do we put our clean gloves on? Because we want to remove the old dressing from the abdomen. I should start there, I guess. So let's do that. Let's put the abdomen back, and we'll start off with the removal of the dressing. Okay? Clean gloves and removing the dressing. So the patient's head is up here. We want to remove the dressing so that the dressing comes off towards us. Okay, we don't want to expose the patient to anything that just might gross them out. Okay, so we're going to loosen the tape first. Okay, loosen the tape on all four sides of the dressing. Make sure that you put the tape back onto itself so it's not sticking back onto the patient. Okay, so remove the tape all sides. Okay, if there's a drain present, we're going to make sure we don't pull the drain out. Okay, we can either undo the tape here and remove it like this, or just have pulled it off itself. Okay, we're going to do that. And as you can see, we have a surgical staples with a drain in place. Okay, area is slightly reddened. Okay, do you expect to see that with a fresh surgical? Yes, there's been trauma to the skin, so we would expect to see some red, some pinkness, red, excoriated, painful looking skin. Then we might be questioning that. But this would be a typical assessment finding for a fresh surgical wound. Now, when it came to the actual drainage on the dressing, let's take a look at that. Okay, if I can get it off my glove. All right, so here we have some drainage. Oh, let me see if I can get this off my glove. Hold on a minute, guys. Okay, I'm back. As you can see, I had to get rid of my gloves. It wouldn't come off of it. Okay, so I don't know if you can see this, but I tried to give you what would be sanguinous around this opening here. See this? This would be sanguinous, okay? In here, yellowish reddish would be serosanguinous, okay? And then the yellow would be your serous fluid. Okay, normal healing process. Okay, so you're going to have to know those terms for what drainage looks like. Okay, so we have our abdomen open. Okay, I'm going to move this. I'm going to bring my sterile kit back. Okay, I don't know if this is just going to be a kind of, sorry, I didn't mean to make you dizzy, repeat from earlier, but it's always good to have a refresher. Okay, so we removed and disposed of our soiled dressings appropriately. How did we do that? We put it in a bag that is actually in our sterile kit. The dressing is sitting there ready to go into the kit. Okay, so we're going to open up the kit away from us, towards us, to the side, and to the side again, right? Okay, here's our bag. We're going to make sure that we have a bag set up on the side. We're going to make a cuff on the top. Oops, you can't see this. This is our bag. We're going to open it up, make a cuff, and stick it close to where we're going to be working, okay? So I'm going to kind of stick this over here on the side, and that's where that dressing that we took off the patient is going to go in there. Okay, when we took it off of the patient, because I didn't do that because I wanted to show you guys. When you take it off the patient, you take it away from the patient so they can't see it. So they should be seeing, you know, like that, not the full assault of it. Okay, you're going to fold it in half, okay, so it's, and then stick that in the bag, okay? So now you have your kit open. As you can see, we're at the sterile gloves. We have a mask. Okay, the mask should actually be on top of the sterile gloves, just to let you know. So we're going to put the mask on because this is a sterile procedure. Some facilities will actually want you to wear a bouffant cap as well when you are doing a sterile procedure, okay? So at this point, you would remove your gloves, put them in that red bag, that bag that you have for you. Do your hand hygiene and put on your sterile, and remember, you're not going to be moving your sterile field like that. I'm just moving it for video purposes, okay? You're going to open up your sterile gloves. You're going to put on your sterile gloves, okay? Y'all know how to do this. Remember to move your finger out of the way so you're not touching this cuff right here. You don't want to be touching that, right? Okay? If you break your sterile gloves, what do? You just go get another pair. Right, exactly. So now that both of my hands are done, I can manipulate the gloves so that they're fitting me better, okay? So I have my sterile gloves on. This you would leave where it is, but for this thing, I'm moving it out of the way, okay? Okay, so now we have our kit. Our kit is open, remember? Our sterile kit was open. What is in our kit? Well, we have alcohol swab sticks. Some places will have alcohol in a, or betadine in a container that you would actually pour onto gauze or cotton balls in order to clean the site, okay? This one has swab sticks, so you would open up the swab sticks. Okay, get this all ready. Good. Next thing you have in your kit is a povidone iodine ointment. Some physicians, some facilities require this to be put on your wound, so you have that. If you needed to put it on, you would open it at this point. You have tape ready for when you're ready to put that on, okay? But you don't want to get that ready right now because that's not until after you have it covered and you don't need to maintain that massive sterility, okay? In here comes with a small split gauze, and that will go around the drain that's there, okay? We also have some more gauze that we can use to cover the surgical staples if that is what is ordered, okay? We have scissors in case we need to cut anything. We have a Q-tip in case we need to clean. And then we have an occlusive dressing that we'll be utilizing at the end, okay? So that's what's in the kit, okay? All right, so now I'm going to bring the abdomen back. Sorry guys, it's a little disjointed, but I'm trying to make it up close and personal so you can actually see what is going on, okay? I'll move it. All righty. Okay, here we go. So as you can see, we have a drain that's in place. We have to clean around that, right? We have a surgical incision site that needs to be cleaned as well. So this comes with 3 alcohol swabs. So you're saying 1, 2, 3, 4. We need actually 4 swabs for this. So what could you do? That's right. You can get somebody to bring you some more of these, right? Why not? Or if your kit came with one of a Q-tip, could you not stick that inside of the swabs here and you know, get it wet with the solution that's on them? Yes, you could. Now I have 4 sticks, right? Exactly. Okay, so we're going to take 1 swab. 1 swab goes down one side, okay? Whoops, Just go down once, just like this. Don't go back. And that goes into the garbage, okay? Another swab goes down the other side, okay? One swab goes around one side of the drain, okay? We're going to clean the other side of the drain, okay? Again, assessing the whole area, okay? So we've done that. We've cleaned everything. One swab for each side of the skin, of the wound, right? Okay. We're going to dry the surrounding area if that's the hospital policy. Some policies are to allow that antiseptic to sit on the skin and dry by itself, which helps to take care of the microbes, okay? Some facilities may actually have you dry the area. You just take, can you see that? You just take a piece of gauze and dry the area, okay? Just like this, okay? All right? So do you think that this hand is sterile anymore? No, because I've touched this right here, right? So really all the work that I'm doing is going to be with my one hand, right? Yes. Okay. So now I have completed that, and I would put on the iodine or the ointment or whatever it is that the physician wants you to put on, if anything, onto the wound or around the drain, okay? At this point, I would put the cut gauze, if it's big enough. This one's not, but if it was big enough, it would go around the drain like that, okay? If I had a surgical incision that the physician would like me to cover, I could very easily take a piece of gauze, and you could leave it like this, but really we don't need it that big, so we could fold it in half, right? And then we could then tape all of this in place, okay? So now you're going to use your tape and tape it into place. I'm going to get another roll of tape. I don't want to use that one. Hold on. I'm coming. I haven't left you guys, really. I just didn't want to use up all the tape that was in this kit, okay? All right, so then we would tape this into place, okay? Being careful to tape around everything. Make sure you don't occlude that drain, okay? It may take a few. Be careful where you're putting the tape. Make sure that you're not hurting the patient, okay? Okay? And you would tape everything in place, or however it is, okay? So now we've got that, right? Or without all that tape, okay? Instead of putting all that tape, you could have used an occlusive dressing like this, and you peel it off like this, okay? And you would put it over everything. But with the drain in place, it's kind of hard to use an occlusive dressing, okay? So then you would either leave it like this where it's draining, which I highly doubt that that's going to happen, okay guys? Mainly, a lot of the time, what would happen is that we would end up putting an ABD pad over the top of that drain. An ABD pad is just a big pad, okay? It comes folded like this in a package. Oh, boy. Let me move that. Oh, try to make you dizzy again. Looks like this, okay? And you open it up and see how big that is? So do we need it for as big as that for this? No, we don't. So we could fold it into itself like that and put this here, okay? So really that's how that dressing would look. Okay, and you would have that drain, because that drain is going to be draining, right? That's the reason why it's there, is to drain whatever's in the abdomen to come out, right? We don't want it just draining onto the bed, right? So we would put the ABD. We could have done that without putting all this tape on them, right? Without all this tape. Let me do this. Okay, if there's a drain like this, we could have put gauze, okay, in place. I'm giving you all kinds of examples here. We could put cover the surgical incision, right? And then we could put the ABD on the drain like this, and then tape that into place, okay? And then we wouldn't be using as much tape on the patient, right? So, you know, you just have to look at the wound, look at your policies and procedures, follow the directions of the physician and how they would like the wound care done, because, you know, some of them are very particular about how they want the wound care, okay? So that is skill 18.3, advanced dressing change.